Great River Health brought together 3 hospitals with visionary boards and executive teams who shared a common goal: providing quality health care to their communities, keeping care as close to home as possible, and trying to make sure that the decisions on healthcare in Southeast Iowa were made locally.
I joined the board of directors in 2014, which at the time was Great River Health. And our number one objective was to remain independent as a health system because we knew how important it was to have independence so we could control the destiny and the growth of the organization. We also realized that healthcare costs were becoming more and more challenging every year, and that operationally we were going to be challenged to be able to keep the organization viable and independent. But then an opportunity came up to talk to Fort Madison about joining Great River Health. And it took a couple of years of discussions, and I don't want to call it negotiations, but more discussions about each visions for healthcare. And in 2018 then, we joined with Fort Madison. Fort Madison became part of Great River Health. Over this same period of time, we had a management agreement with Henry County Health Center over in Mount Pleasant. But we thought there was probably an opportunity again to expand our patient care by bringing them under our organization. It was a little more complex with them because they were a community hospital owned by the county. All their employees worked for the county owned the grounds. And it would take a vote by the population of Henry County to approve that merger. But a couple years worth of work, we had the vote, we won the vote overwhelmingly. And so then Henry County became part of Great River Health. So now we had 3 hospitals that we were able to, if you will, provide consistent quality care using similar policies and practices. And so that when a patient walked in the door at Henry County or West Burlington or Fort Madison, they're going to receive the same quality of care using the same procedures and policies that are used at any one of the campuses. And today we have a much stronger organization because we're all together.
Great River Medical Center, Fort Madison Community Hospital, and Henry County Health Center each had a deep heritage of serving the people of Southeast Iowa.
Believe it or not, there were 3 hospitals in Burlington in 1895. Over the next 75 years, those 3 hospitals, including Klein Memorial Hospital, which was a rehabilitation hospital, merged to form Burlington Medical Center, BMC. Burlington Medical Center then provided healthcare services from its downtown location until its move to our current location in the year 2000. It then became renamed Great River Medical Center. Great River Health System then became the parent organization that was over Great River Medical Center and its entities. It then became Southeast Iowa Regional Medical Center when Fort Madison joined the team in 2021. No matter what the name, Great River Health has been a key player in the stability of our region, in its economic growth, and for our community. They are the largest employer, they are a financial contributor for many community organizations, and they're the largest provider for healthcare services in our region. For the future of our communities, we need to come together to remain strong and relevant.
For our Fort Madison community, we have a long, rich history of healthcare. So it started back in 1901 with our St. Elizabeth Hospital, and then that became Sacred Heart Hospital in 1912, and that was ran by the Sisters of the Third Order of St. Francis. And that stayed in existence until 1977 when we had a not-for-profit board of directors and we purchased Sacred Heart Hospital for $1 and that became Fort Madison Community Hospital. But rural health care is very important. You know, people can't always travel, so it's providing much needed services from the clinic to ancillary service to inpatient care, OB services, 24/7 emergency. You know, we're right there in the folks' backyard, so it provides them that opportunity when they're in need for us to be able to provide that service so they don't have to travel. So it provides us that opportunity to look towards the future and still be here for our community.
For over 100 years, Henry County Health Center has provided for the county's healthcare needs. Henry County Soldiers and Sailors Memorial Hospital was dedicated in December of 1921. The hospital was built on the vision of community members who understood the value of providing quality health care locally. Healthcare delivery has changed a lot over those 100 years, but what has not changed is our focus on taking care of our patients. As a county hospital, we understand providing healthcare that is both convenient and high quality is vital to the health of our communities. But our influence extends beyond the four walls of the health center. With an active auxiliary, the Friends of HCHC, and Henry County Health Center Foundation, and the many volunteer hours employees give back to our hometowns, Henry County Health Center is an integral part of the success of Henry County.
We came together in collaboration instead of competing, and with the Keokuk Clinic and our other rural health clinics, we continue that legacy into the future. This collaboration has ensured our families, friends, and neighbors have access to the health care they need and deserve. Building on the assets of each organization and the support of each community makes us stronger together.
We were getting a lot of questions at the time, as you can imagine. The biggest one was obviously why? Why are you doing this? You guys really must be hurting if you're looking to join another health system. Are you going out of business? Are you laying off staff? Are you planning to do away with some services? And I think the public had seen what had happened with neighboring facilities and were jumping to some pretty logical conclusions. But the reality of the situation was quite a bit different. Fort Masson Community Hospital was in the midst of reclaiming financial sustainability. We were hiring more doctors than we knew what to do with, and staff were getting raises, all while we were taking great care of our patients. That's really what it was about, and we were honestly doing quite well at the time. Our concerns weren't really about today, but instead about tomorrow. We wanted to always be there to provide great care to our patients. And our board and leadership team were progressive enough at the time to recognize that the industry was changing, and we needed to change with it or risk that overriding imperative, that we're here for the patient. So we began that journey from a position of strength. Really, there's no telling what people can accomplish when you're able to set aside your differences and come together for a common purpose. For us, it was and will always be about the patients. Our hospitals were very competitive over the years, but we checked our egos at the door and decided to simply do what was right, and that was making a difference. And so we're seeing the coordination of patient care across geographies. We have shared records, we have shared staff, we're seeing improved access to specialties, we can support more advanced equipment and technology, we can make investments in our people, our patients, and our communities together. And things are always better when you do them together.
The driving concerns at the time of joining Great River Health System was we were an independent critical access county hospital and been in existence for over 100 years. And it was the healthcare environment, recruitment, the lack of reimbursement from payers, all those stuff really was starting to stress our facility. The biggest benefits to the community and to the hospital has been we have more resources available to us from the health system that we never had as an independent. We have increased our service levels at the local hospital, and we're keeping things local at the hospital. The financial benefit to the local hospital has been our increased services, which has increased our revenue.
Taking care of each other and caring about what you do will translate into giving great care and patient experiences to our friends, families, and neighbors. As we move into the future, we will continue to look for opportunities to remain the right place, providing the right care right here in Southeast Iowa.